All right, well, I guess we'll go ahead and get started. Good afternoon, everybody. Welcome to IPHA's Third Thursday Lunch and Learn web series. My name is Brett Norris. I'm the communications coordinator for IPHA. Thank you for joining us today. We've got a great lineup of speakers this whole Lunch and Learn season. We're glad that you can make it to this one. This session is being recorded and it'll be posted to the IPHA YouTube channel later this month. Before we go ahead and get started, just a couple housekeeping items. Your microphone should be muted during the presentation just to help keep enough bandwidth, which we already know I'm having trouble with anyway. And so that way we can see and hear the presenter. You can put your questions in chat or Q&A here on Zoom, and there will be plenty of time for live discussion where you can unmute, turn your camera on, and we can have some discussion. Today, our speakers are Bethany Snyder of Snyder Strategies and Keenan Crow of One Iowa, who are going to speak with us about LGBTQ advocacy. Sharon's going to help lead the discussion and Q&A part, but for now, I'll hand it over to Bethany. I think she's going to kick us off.
Yes, hi everyone. I am so grateful and thankful to be here. Again, my name is Bethany Snyder, and I'm actually a member of IPHA, and I've engaged with many of you in different ways. But the hat I am wearing today is I am the board chair of One Iowa Action, and that is the 501c4 of One Iowa. So we can talk a little bit more about what that means, but it's really just the advocacy arm of the nonprofit that engages on the legislative agenda, et cetera. And just want to, before I introduce Keenan, want to put a little bit of context. You guys know why. I think you already know how LGBTQ issues and public health connect, but just to put a finer point on that, you'll hear throughout this presentation on, some of the challenges that the LGBTQ folks are facing, and just realizing that there are real people that are traumatized and suffer when we have this sort of political environment for our community. And so you as public health professionals may see this in your community. I just want you to be cognizant of that. We're going to be talking a lot about trans youth, which are very vulnerable. Oh, remember to put yourself on mute. A very vulnerable population that also they don't live in a vacuum. They hear these things, they see this happening in their community. So I just want to connect that to the work that you're doing, and thank you for being here. I'm going to introduce Keenan really quickly. They can introduce themselves, but I'm Bethany Snyder and I use she, her pronouns. And Keenan uses they, them pronouns. And I met them when I first moved back to Iowa. Of course, always one of my first goals is I need to connect with the statewide LGBTQ organization. And I've been doing advocacy for like 20, 25 years. And so I engage and meet lots of people who do advocacy. And I was immediately impressed with Keenan. They are so smart and so strategic. And I instantly felt like, okay, we have a chance in Iowa with Keenan leading. So I'll let Keenan talk more about their experience and background, but I'm going to turn it over to them to share. And just if you might hear terms that you don't recognize, that is fine. Put them in the chat and I will help either explain those terms, or Keenan will see that and they will explain them. But please don't be afraid if you hear or see a term that you don't recognize. Ask that question, because there's for sure other people who also, and Keenan and I do this all the time, we forget what level of knowledge people have about our community. So please let us know. We will not be offended. That we're here to teach and learn. And then also, if you have a question for Keenan, please put those in the chat and I'll try to moderate that as well and answer any questions I have that I can. So thanks again, and I'll turn it over to Keenan.
Yeah, thanks so much, Bethany, for that very kind introduction. Maybe even too kind, one might say. But yes, my name's Keenan Crow. I'm the Director of Policy and Advocacy at One Iowa Action, which means I am our primary lobbyist, the person that kind of goes up to the Capitol, and the person that monitors exactly what our opposition is doing at any given time. So a pretty good pulse on kind of not just state trends, but national trends, and kind of where this is headed and what we can do about it, which is the more important part. Because if you just know that something is happening, that can kind of be frustrating if you don't know how to fix it. So we will go over some quick and easy ways that you can help as well. Let me just start, though, with kind of where we're at here in Iowa, because I don't necessarily think most people know. I will also just very quickly define sexual orientation and gender identity protections, because that's going to be important for like the entire part of this presentation. So sexual orientation can be thought of as kind of basically the propensity to have relationships with certain types of people, right? So straight is a sexual orientation, gay is a sexual orientation, bisexual is a sexual orientation, etc. And it's different from gender identity. Gender identity is how we see ourselves in a gendered sense. So transgender is an umbrella term for a number of different gender identities. The opposite of transgender, though, would be cisgender. So, and these aren't like made up or anything. We didn't just like come up with mouth sounds for these. They're Latin roots. So trans can be roughly translated as different, and cis can be roughly translated as same. So when you're saying somebody is transgender, it simply means they have a gender identity that is different from the sex that they were assigned at birth. When we say someone is cisgender, that means their gender identity is a pretty good match for the sex that they were assigned at birth. So most of the people that we encounter are cisgender people. They're not transgender. So if you hear me use that term, that's what I mean by that. So having that unpacked, one of the nice things about Iowa is that it does have comprehensive anti-discrimination protections on the basis of both sexual orientation and gender identity. So it covers the entire LGBTQ community. And we've had those since 2007. So well over 15 years now. We have had comprehensive protections in the areas of employment, education, credit practices, public accommodations, and housing. Those are not necessarily rock solid here in the state of Iowa, and we'll talk about that as we get through this presentation. But we do currently have them, and that puts us ahead of roughly half of other states here in the country. That said, that is not the case, as I said before, for many other states. So, for instance, my family lives in the Sioux City area, which is partially in South Dakota, partially in Nebraska, and partially in Iowa. And my stepfather lives in Iowa, but works in South Dakota. Now, he's not a member of the LGBTQ community, but were he a member, his rights would change significantly as he crosses the state line and goes to work, right? South Dakota does not have those comprehensive protections in that way. One of the things that we're trying to push for as an organization to kind of right that wrong and make sure that your rights don't change based on what zip code you live in is the Equality Act, which is an explicit nationwide anti-discrimination protection for sexual orientation and gender identity that is essentially just added to, it's just classes added to existing anti-discrimination protections that are already federally on the books. There is one exception to this, and that is the Bostock ruling. So Bostock v. Clayton County was decided in June of 2020 by a very conservative Supreme Court, and actually penned by Justice Gorsuch. And what Bostock says is, so like imagine a situation where a gay man is being fired for being married to another man, right? They are firing him for being a man married to a man, but they wouldn't fire that person if it was a woman being married to a man. And so the analysis is essentially you have to take sex into account in order to accomplish that discrimination, which means it is in fact a form of sex-based discrimination, and sex-based discrimination is prohibited at the federal level. So in terms of employment protections, those do exist, not because we have an explicit statute, but because of an interpretation from the courts that essentially says sexual orientation and gender identity discrimination are simply forms of sex-based discrimination. Now, we know that applies to employment. We think the rationale is pretty solid that it should apply to other areas as well. But that is, again, kind of up in the air and up for the courts to decide. The interpretation seems like it would carry over, but just because something seems like it's going to carry over in the courts doesn't necessarily mean that it will. So that's kind of where we're at in terms of both federal and state policy, kind of in a broad sense in terms of anti-discrimination protections. Unfortunately, we're kind of heading in the opposite direction. So if you look at the number of anti-LGBTQ bills that are active in any given session, that has been going up kind of exponentially since about 2019. And last year, We had 28 different anti-LGBTQ bills on a range of different topics to fight. Now, what are those topics? Well, they kind of vary, but there's a very clear trajectory in what they're focused on. So in 2019, you see kind of an equal mix of civil rights rollbacks, medical denials, religious exemptions, and education attacks. 2020, the religious exemptions kind of take priority. 2021, we get more medical denials and more education bills. And in 2022, the education bills kind of multiply to a significant extent. And the medical denials kind of hold steady. So those are the two areas that are really gaining momentum, are the medical denials and the education policy type attacks, or the attacks on what I would call kind of censorship and surveillance in terms of educational policy. So in 2022, in total, like I said, we had 28 bills that attacked LGBTQ Iowans. 20 of those were focused specifically on transgender people, and 14, so half, were focused exclusively on transgender youth. This is really the new kind of wedge issue that a certain extreme group of the right wing has kind of deemed to be a winning strategy. And so this is the group that they're going to continue to attack over and over again until it no longer yields the electoral results that they want it to yield. And we have seen folks employ that in their electoral strategies, not just in Iowa, but nationwide as well. As I have said many, many times, these are not bills that constituents are asking for. These are bills that are pieces of model legislation, often put together by a couple different organizations, primarily American Principles Project, Alliance Defending Freedom, Heritage Foundation, and Family Research Council. And they introduced them in nearly identical form in basically any legislature that has a conservative chamber or a conservative trifecta. So that's why we're seeing the exact same piece of legislation pop up in state after state after state. If you look at, for instance, the Iowa ban on transgender participation in school athletics, that is word for word the exact same piece of legislation that passed in South Dakota, the exact same piece of legislation that passed in Florida, the exact same piece of legislation that passed in Utah, et cetera, et cetera, et cetera. All they're doing is changing the state name, right? These are not like novel new ideas. These are part of a coordinated political strategy. And we see that mirrored in state legislatures across the country. So not only are these bills multiplying in Iowa, they're multiplying in state legislatures literally everywhere in the US, and kind of roughly doubling every single year, year over year, when we look at the anti-trans bills in particular. So this is something that is a problem in Iowa, but it's not just a problem in Iowa. It's a problem literally everywhere right now. And we ignore it to our own detriment. It is getting worse rather than better. And particularly in Iowa, our pro-equality numbers have shrunk significantly between the primary and the general election in 2022. And we are a nonpartisan organization. By this, I don't mean that we have more Republicans. I mean that we have fewer allies in the Republican Party. We have more extreme voices in the Republican Party. And so the pro-equality votes are going down. It's not about D or R. It's about, are we willing to support equality regardless of what party we are a part of? And so many moderates on our issues have actually been ousted, and in some cases replaced with people running anti-LGBTQ hate groups. Helena Hayes, for example, ousted Dustin Haidt in the primary, and she runs a group called Protect My Innocence, which its entire inception was a trans person went to the pool once. And so we want to ban trans people from going into public facilities. We want to ban books from public libraries, not school libraries, but public libraries. I mean, just like really, really extreme stuff. And we know that several of those candidates, including Helena, won races in 2022 with explicitly anti-LGBTQ rhetoric. And here's just a few examples of the many, many examples I have in a folder on my desktop of those kinds of messages that we were seeing. You know, we want drag queens in every school. We're letting child molesters free because they're transgender. We are trying to get porn out of the library, which there is no porn in the library. So again, these are just a smidge of the many, many examples I have of folks who are running on these really, really extreme platforms. There is some good news, though, and that's number one, we have more LGBTQ folks in Iowa legislature than ever. We have Liz Bennett, who is in the state Senate, and two other queer folks, Eleanor Levitt and Austin Harris, who are in the Iowa House. The other thing to consider is that even though a number of folks won on those platforms, that it seemed like that was a desperation move, essentially. That when we actually dive into their numbers, the vast majority of people that employed these tactics actually pulled significantly worse than the governor. So, for instance, Jeff Shipley, the governor went 70-30 in Jeff's district, and Jeff went 60-40. That works when the governor goes 70-30 in Jeff's district, but it doesn't work when the governor goes 55-45 or somebody else on the top of the ticket performs better. So while some folks would say this gives them kind of a mandate around these issues because they ran on them and won, I think if you actually dig into the numbers, it tells us something a little bit different. It tells us that, yes, they won, but was it because of this? No. And in fact, it probably made them worse off rather than better off. The other good news is that we know advocacy works, right? Like, we know that if we employ regular folks to go and talk to their elected officials about why this matters to them, that it doesn't change people's minds 100% of the time, but it changes people's minds a certain percentage of the time, and that's worth doing, right? If you haven't read Governor Spencer Cox's statement, for instance, on why he wasn't going to sign the transgender athletics ban, it's a great piece. Again, a Republican, but someone who knows that cruelty is not government at its best, right? That this is simply targeting a very, very small group of people, and that legislation doesn't benefit anyone. It is literally just intended to harm a specific group of people without benefiting the whole. Really, what we should be focusing on when we're talking about public policy are measures that improve people's lives, not just target some people for worse lives and worse outcomes. And that's exactly what this kind of legislation does. So what are we looking at in 2023? Well, this is my list kind of in order of how likely I think it is to happen. Obviously, based on the trajectory, both in Iowa and nationally, and looking at the makeup of the chairs and members of the education committees in both the House and Senate, I think we're in for a lot of hurt around education policy. In particular, they've been discussing a don't say gay or don't say trans type bill where they would be prevented from speaking about sexual orientation or gender identity in any capacity up to a certain grade level, and then creating kind of vague language to discourage it after that grade level. That's probably going to be paired with a forced outing piece. And what I mean by forced outing is a teacher, for whatever reason, finds out a kid is gay or transgender. A good example here would be a kid says, hey, could you use a different set of pronouns for me than you've been using before? Now that teacher has a piece of information about that kid, and this kind of legislation would essentially force them to go and report that to the parents as soon as they find it out. And that can be incredibly dangerous for young people who are in homes that are not accepting for a number of different reasons that I assume that I don't have to unpack here. But if I do have to unpack it, please let me know. We also are looking at material bans. You saw before, like the postcard from Helena, we have to get these books out of our children's libraries and out of public libraries and out of every library so that nobody can see them ever. Really what these school-centric anti-LGBTQ bills are about, as I kind of mentioned before, is surveillance and censorship. Those are really the two kind of keys that we're looking at there. So, I mean, really what it seems like to me is somebody read the book 1984 and said, wow, this is a swell idea. How can we implement this in the state of Iowa as it pertains to queer people, right? How can we make sure that we censor everything about them, and then make sure that we maintain eyes and ears on all these queer kids so that we know what they're doing at any given moment? And this has been taken to even further extremes in other areas of the country. It just came out yesterday, for instance, that Texas is now literally creating a registry of every transgender person that lives in the state based on driver's license changes, birth certificate changes, a number of other metrics that they've created. I hope I don't have to tell you that when we start creating registries of disfavored groups of people, that it tends not to end well, that is the first step in a very, very dark path that folks are going down. These kinds of bills are the first step. This is what hits before the registries. It's this kind of censorship and surveillance type stuff, and it only escalates from there. A few other things to look at. We are hearing about legislation or oversight hearings on gender affirming care for minors. This has, again, been something that we've seen in many, many other states. So Texas, Florida, Arkansas all have bans on gender affirming care. This puts physicians in a really impossible place where they either have to kind of comport with state law or follow their ethical obligations and obligations from their licensing bodies. In particular for this group, I think this is something that we could really use your help with in trying to push for regulations that are based on science and are based on evidence and not based on people's biases. This legislation has absolutely no rational basis at all. It is literally just about fear, scare tactics, and trying to target a group of disfavored people for disparate treatment. A few other things to mention. RFRA, the so-called Religious Freedom Restoration Act, is anything but that. It is really just a piece of religious exemption legislation that lets people pick and choose which laws they're going to follow based on whatever religious beliefs they profess to have at the time. There has been talk about removing gender identity as a protected class, just like yanking it right out of the Civil Rights Act entirely. I'm not sure how much support that has. The more discussions I have, the less support it seems to have, but we won't know till we know, so I'm putting it on your radar regardless. And then, of course, whatever Jeff Shipley hears on InfoWars. He is a prolific writer of anti-transgender legislation based on conspiracy theories. And so I assume we will see much more legislation based on conspiracy theories as that moves on. I will also note he is the vice chair of the Government Oversight Committee. And so those oversight hearings are likely coming because of him and may motivate legislation to that effect later on. So we need your help to repel attacks like the ones you just saw, to attract top talent to your organizations, to your businesses, to keep the talent that you already have, to protect your friends, family members, and coworkers from harm, and to give Iowa a reputation as a welcoming place where anybody can safely raise a family, right? If we really want to attract folks to live here, if we really want our communities to be a better place, we can't arbitrarily exclude a group of people just because of their sexual orientation, gender identity, race, disability status, you name it, any sort of immutable characteristic that we're talking about. That is not, again, where government is at its best. And your help in particular, as Bethany said, right? We need public health professionals to speak out against this legislation as soon as it is introduced. Just because it's not debated or just because it dies in committee doesn't mean that it doesn't have negative social and health impacts for LGBTQ people, and in particular LGBTQ youth, who are being directly targeted by their government. Imagine how that feels to be someone who is already scared and marginalized and feels like they have no power, to have the most powerful people in your state debating your right to get medically necessary health care. That's terrifying stuff, right? That makes you feel really, really awful and hopeless in a lot of ways. So the more folks speak out, the earlier they speak out, we hope that results in fewer bills being introduced in the long run. The more opposition they face from this, the less appealing it's going to be. And I know that you folks know this, but I'll spell it out real clear. Health and well-being are not just about access to services. It's not just about, can I go to the doctor and, get treatment for strep throat or whatever it is. The stress introduced by the constant ongoing attacks by LGBTQ people demonstrably leads to negative health, social, and financial outcomes. Folks who can't be out and open and authentic are less satisfied with their jobs. They're less healthy. They're less psychologically healthy. They're more likely to self-harm. They're more likely to engage in destructive behaviors. They're more likely to have suicidal ideation, and on and on and on and on. So this really is a public health issue. And I know you folks know that. I know that I'm probably preaching to the choir to a certain extent here, but I really can't emphasize enough that this is not theoretical harm. We have heard of folks who have harmed themselves because of this legislation. I know of folks who have taken their lives because of legislation that has restricted care for transgender folks, because we've already seen it, right? Right now, Iowa folks on Medicaid here in Iowa cannot get the surgical care that their doctor has deemed medically necessary because of a legislative restriction that passed back in 2019. So these are not theoretical harms at all. These are real harms that happen to real people. They are making our state worse, and we need your help. So a few ways you can help. Number one, you can show up to LGBTQ events. You came to this training and of your own volition, I imagine. So you're already well on the pathway to attending LGBTQ events and getting more information. We are going to have our lobby day on February 1st of 2023. We invite any and all public health professionals to attend and help us amplify the voices of queer Iowans and their allies. You can talk to your friends and family members about why equality matters to you. The reason that we have significant numbers of the Iowa delegation in Congress voting for a marriage equality bill in the last few weeks is because people talked to everybody around them. They didn't just talk to their legislators. They didn't just talk to people in power. They talked to their friends, their family members. They said, oh no, I think Dave down the street does deserve to have the exact same rights as I do. And here's why. That culture change is just as important as the legislative change because those two things are symbiotic, right? Legislation often lags behind cultural change. And so we have to be pushing those messages because our opponents are counting on creating consequences so severe that talking out about this is going to create consequences for you, right? And the fewer people they can give those consequences to, the easier it is for them to make those consequences stick. The more people that are talking about this, the more people that aren't apathetic about this, the harder their job becomes to marginalize and silence us over the long time. You can also volunteer or donate to organizations working toward full equality for LGBTQ Iowans. It's definitely not just us here at One Iowa. It's also Iowa Safe Schools. It's Interfaith Alliance of Iowa. It's ACLU of Iowa. It's Planned Parenthood of the North Central states. It's all these organizations kind of working together in concert to try to reduce some of the harm that this legislation is inevitably going to cause. And of course, you should contact your legislators, both in an individual capacity and as a member of any organization that you can get to motivate to speak up. The larger of an organization you can motivate to speak up about this, the better chance we have of beating it, right? If one person says, I disagree with this and I'm your constituent, that's good, but it's much better if 1,000 people all at once and in the same voice say it at the same time. So ask them to oppose discriminatory legislation. Tell them why it matters to you. Tell them why it matters to your job. Tell them why it matters to your professional organizations. Tell them why it matters to, on and on and on again. Whatever capacity you can help in and whatever power you have in your job, in your organization, whatever else, use it, right? That is really the goal here, is to get everybody to do something, whether that is just having a one-on-one meeting with your legislator, or whether that's motivating an entire policy organization to show up and register against the bill. Whatever you have the power to do that thing. Right. And that can look very different from person to person, depending on who it is. But I know you folks in particular have some expertise, especially in the area of healthcare and in the area of how this harms folks. And we could really use your help and your voices on this. Of course, stay informed, come to events like this, follow us on social media, sign up for our action alerts at oneiowaAction.org. That's our rapid response system so that we can let you know what's coming down the pipe and how you can kind of immediately help when the time comes. Like I said, register for our lobby days. And if you have questions, concerns, legislation you think we should support, legislation you think we shouldn't support, whatever it might be, shoot me or Bethany an email. Here's all of our contact information, our phone numbers. You can carrier pigeon us. I don't, whatever you're most comfortable with. I will take carrier pigeons over phone calls every day. Text me. But whatever you're most comfortable with, I'm comfortable with that as well. So that is the end of me talking at you. What I really wanted to save some time for and to address in full is any questions that you folks have. And so we can use the rest of the time for those questions.
Thanks, Keenan. Sometimes during your presentations, I oscillate between, abject fear, and sadness. And then, as a queer person, someone married to a trans person with a, gender fluid kiddo. But then I am reminded of, I kind of get a little worked up about it. I'm reminded of like the strength of our community, how we could not have made the progress we've made in the last 10 years without people sharing their lives, sharing about their families, coming out, and folks like the Iowa Public Health Association, who I know you have queer family members, queer colleagues, but also have a commitment to serving marginalized and underserved communities. So, and I know that our allies like you have had to come out as well. So thank you so much. And yeah, we'd love to take some questions or have some discussion around this. Maybe you have questions about how do you talk about this with your boards of health? I'm sure that's really scary for a lot of you, but that's a place where you can talk about the adverse health, public health effects of this kind of legislation. So we already have it. What are some of the ways that you have talked to people in your community, or you've seen these things in your community? Have you had organizations coming to you, et cetera? John Shaw asked, how do the proposed legislations on gender affirming care affect intersex children?
That's actually a great question. So I have helped in previous years to actually introduce bans on medically unnecessary surgeries for intersex infants in particular. I think they're incredibly harmful, and having spoken with countless intersex folks over the years, I've seen the direct harm that those things cause. One of the interesting things about the Medicaid ban on gender affirming surgeries is it accidentally banned surgeries, medically unnecessary surgeries on intersex infants. So that part was a good part of that particular ban. Normally, though, what happens with these, and I have not seen the piece of legislation that they're likely to run yet. We've seen some pieces of legislation in previous years. Some of the previous years, though, I think comport with what I'm about to say. And that is often when we see these gender affirming care restrictions, they have specific carve outs for intersex infants. So they are actually stopping the care that everybody agrees is actually good and necessary, and allowing for care that the intersex community has identified as uniquely harmful and kind of horrible. So it's kind of two birds with one stone in the worst possible way, unfortunately. And that's often what we see. It's also what we saw in Arkansas. It's what we saw in, Florida, Texas, etc. All these places where these care bans are going up. Intersex children are often, the idea here, the real core idea that gets down to this is if it reinforces cisnormativity, right? The idea that the sex that you were assigned at birth will determine kind of your gender role in society, then that's okay, and we're willing to pay for it. But if it goes against that, if it somehow allows transgender people to get the care they need, then we're not for it, right? If it in any way kind of challenges the idea of biological essentialism around gender, then we're not going to pay for it. But if it reinforces that, hey, yay, that's great. We'll totally cover that, even though we know it's kind of harmful. And that's a great question too, because it's not something that most people know about.
Keenan, how will these bills address gender blockers for hormone blockers for cisgender children? So we know that hormone blockers have been used for, I don't know if I say centuries, since they've been come out,
decades at least. Yeah.
Young women or girls who get their periods too early or for other conditions. So will it be a blanket ban on that, or will they carve out for those? Like, yeah, how will they address that?
Yeah, again, it's likely to be a carve out, right? It's likely to be anything that challenges biological essentialism is going to be carved out, and anything that kind of reifies it is going to be allowed and potentially even subsidized by the state in some cases. So it's a very odd. It's coherent, but it's coherent in a bad way, if that makes sense.
So I've heard Dr. Robus, I think from Children's Hospital, talk about that hormone blockers have been around for centuries. We've been using them with children with no adverse effects.
Yeah,
medical conditions.
And one thing that you'll see over and over again in these conversations is that our opponents will kind of take what are mostly intractable problems in the US medical industry, right? And they will explode them and pretend like they're unique problems to gender affirming care. Like, oh, people make money off of this. Like, yeah, have you seen the for-profit insurance system lately? People make money off all sorts of medical care at all times. It's not like any of this is free or anything like that. And the other thing they'll often say is, well, there are side effects. Oh, well, yeah, there's side effects with literally any procedure, with literally anything. And there's people that regret it. Yeah, absolutely. Again, there's regret with literally anything. The regret rates are so low, though, that they are virtually non-existent. It's like 1% or something like that. If you look at other procedures, other medical procedures that are relatively common, I mean, look at bariatric surgery, for instance. The regret rate there is like 20%, something like that. And yet there's no rush to outlaw bariatric surgery on the basis of regret rates. What the ultra low regret rates actually tell us is that maybe we're setting the bar too high, that we're actually preventing people from getting care that could benefit them because we're so concerned about this regret portion that we're not willing to give care to people that would actually benefit from it. So it's just like anything else. It's a balancing act. And and John Shaw says, I think you're referring to conditions like chronic adrenal hyperplasia that often leads to precocious puberty. Yes, absolutely, that's what we're talking about. And the side effects are well known, and it's not like they're getting counseled in any way that's different from someone who has adrenal hyperplasia, right? We know that there can be, for instance, impacts on things like bone density or whatever else, but the benefits outweigh the costs in a lot of situations, and that's just like any other procedure, right? Like, there's no difference here. The only thing is, in one case, it's for a cisgender kid. In the other case, it's for a transgender kid. That's literally the only difference. There's no additional risk to transgender kids in any way, shape, or form. The additional risk is not treating them, because then we're looking at serious risks for suicidal ideation, self-harm, depression, anxiety, chronic substance use, all sorts of other things that are much worse than maybe a slight risk for some lower bone density, right? So the actual scientific arguments around this are not arguments. There's no debate here. The debate is over. It's been over for forever. These are simply political tactics. They're not actual scientific discrepancies in any way, shape, or form.
Please throw your questions in the chat, or raise your hand, or come off Zoom. Another thing that I've heard you talk about, Keenan, before is the political considerations. And I have heard you mention or say words like, this is not politically risky to support this, or can you talk a little bit about that?
Yeah, so in terms of kind of anti-LGBTQ legislation, what we see is the legislation that polls the best, even in Iowa, are the transgender athletics type things, right? And even in Iowa, those are like dead even. The last time the Des Moines Register did a poll on that, it was roughly 50-50, with 50% supporting, 50% against. I think there's like plus one or two on either side, but I can't remember. It was nearly tied on that respect. The in terms of medical care bans, the surveillance and censorship stuff, the every other policy that I've listed so far, those are all politically underwater. Those actually don't poll very well. They rile up the base, like the very, very far right conservative kind of extreme social conservative base in particular, but they don't play well with moderates. They don't play well with folks on the left. They don't even play all that well with moderate conservatives. And so there's very little political risk to opposing these policies, because honestly, they're very unpopular policies. Again, this is really just an attempt to energize the base and get people out to the polls, but it doesn't actually, most folks kind of see through this charade.
Yeah, I think that really is helpful to think about it in terms of like the public perceptions of these issues as well. Well, we have, a few more.
Oh yeah, that's a really good question.
Oh, this
and
is
it's
good.
something that I've dealt with over and over and over again in every hearing that I've ever had on this. So the question is, what talking points do you use to debunk the American College of Pediatricians position statement? So some folks don't know, but there is a legitimate organization called the American Academy of Pediatrics that represents pediatricians across the US, thousands and thousands of pediatricians across the US. And then there is a hate group called the American College of Pediatricians that has like 150 people or something like that in it. And it's drug out and named in such a way so as to confuse people on the actual medical consensus around these issues. It is literally just a fringe group to provide politicians cover. It is nothing more. It is nothing less. Its statements should not be taken seriously. And every time I hear it drug out, I simply say that is not a legitimate organization. And I demonstrate why it's not a legitimate organization. I think that anytime you encounter that, you have to push back forcefully as to that's roughly like citing the national group of astrologists when you're trying to make an argument about astronomy. It's literally that black and white in terms of what what one group is saying is totally and completely debunked versus an actual professional organization. I mean, it couldn't be more clear in my mind as to what that group is doing and why they exist. Does that make sense?
Do lawmakers hear that? Is that compelling to them when you explain this is like a fake group?
It depends. If folks are already predisposed to supporting this, then they don't really care, right? Because that group is something that just like reifies their pre-existing beliefs. But if somebody is actually concerned with the facts and with medical consensus and with what the science actually says, that does raise questions for them. I remember, for instance, there was a discussion at the Iowa Board of Medicine several years ago. I think this was all the way back in like 2018 or so, about banning conversion therapy, and one of our opposition groups brought up the American College of Pediatricians, and not only did I bring it up, but somebody else on the Board of Medicine brought up that this is not a legitimate organization that we should be listening to. This is not, an organization that is coming up with their information based on peer-reviewed journals and the best science that we have available. This is an ideologically motivated organization that is just there to make political points, not to engage in any sort of scientific discussion. So it depends on how committed they are to having that organization back up their position versus actually being curious about what the science says. And, I mean, to the extent that politicians care about science, that's the extent that they care about hearing from the American College of Pediatricians.
Yeah, that was a good, thank you, Cheney. Yes, we'd love to hear from other folks. If you ever have any questions about how maybe any specific community questions, we think this, just like the trans athletic bill, I think this, the gender affirming care bill could dominate some of the political discussion at the Capitol, and could filter its way down into some discussions in your own community again. So let us know if you have any questions we can answer.
Hey, Bethany and Keenan. So, tell me a little bit about what it really means that Senator Ernst was censored by a handful of counties.
Yeah, it means nothing.
Really mean?
Yeah, it means nothing. It essentially means we are upset. There's no actual ramification. Actually, Jeff Kaufman, the chair of the Iowa Republican Party, issued a statement to this effect, basically saying there is no actual mechanism for county parties to censure any sitting politician, let alone a sitting senator. It's not a thing. It's just something that they're doing to say, we disapprove of you. It has no impact at all.
Can I, since you brought that up, Sharon, and I can't believe I didn't bring it up because I've only been talking about it nonstop for like the last 10 days. So I want to talk a little bit about that, like what we can learn from the Respect for Marriage Act. So just to remind folks, if really quickly what happened, because the Supreme Court just with the Dobbs decision, under which the marriage equality, gosh, Keenan, you're the one who does this kind of stuff. But anyway, blah, 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 blah. People got scared, and Keenan can talk about it more in a more intelligent way. We're concerned that marriage equality, or states would be able to, like, if I would decide we're not going to honor marriage equality anymore, which is also sometimes called same-sex marriage or gay marriage, then people who if you came from California or married there, we could say, no, you're not, we're not going to respect your marriage here, or what have you, right? Or if it's still legal here and my partner and I traveled to Arkansas and something terrible happened, they might not see us as a married couple and say, no, you can't visit your partner in the hospital, or no, your partner isn't the real father of your child, all these crazy things. So what the Respect for Marriage Act did is just reaffirm that states reaffirm the portability of marriage, really. Said if you are married in one state, you're married in other states, just like your marriage is, everyone on the phone who is cisgender, just like the other marriage laws. And so this is something, having Joni Ernst vote on this, I cannot underscore how much of an advocacy win this is and how much work this took by advocates to reach out to her, and did not say, I'm not going to reach out to her because she's a Republican, or I don't think she'll support this. It was about dedicated advocates who saw an opportunity to educate, and to her credit, to have an open mind. And because so many people reached out to her. So I want us to be thinking about that as a real advocacy win, and what happens when you do stay the course, and really do that relationship building with a lawmaker. Is there anything else you want to add to that, Keenan?
No, yeah, we had been working with Senator Ernst since last year, maybe the latest, essentially on the Equality Act, which is something that I mentioned at the beginning of the call. And the Respect for Marriage Act really didn't come up until a couple months ago. So we already kind of had that relationship with Senator Ernst and her staff, and this was an even easier lift than the Equality Act was, for a number of different reasons. So yeah, it was basically because of a concurring opinion that Justice Thomas wrote in the Dobbs decision, as Bethany mentioned, that called into question a number of different landmark cases and how they were decided, because Justice Thomas kind of doesn't like or respect precedent in a number of different areas, and wants to kind of rewrite that. So yeah, that's basically how it came about. I am seeing a few more questions in the chat. Oh, sorry.
No, yes, I'm going to throw, yes, thanking her. I'm going to throw One Iowa Action has a thank you note already written that you can send her.
Yeah.
So you can quickly, if you would like to thank her, she's getting hammered, by her own part, blah, blah, blah,
Yeah.
blah. So
Yeah.
any kind of things that we can provide is useful. And I think what's also ironic, and I failed to remember this until I started reading more coverage, is that it also codifies interracial marriage,
Yes.
ironically.
Yes.
Just because of Clarence Thomas, I say ironically. So it wasn't just LGBTQ marriages that are protected, it's also some other marriages as well. So
yeah. Someone else asked, are you saying that there is anti-LGBTQ legislation in Iowa right now? So like that's a yes and no in a way. So the Iowa legislature only runs from like January until roughly April, May, June, depending on, there's no hard end date. Right now it's slated for the end of April, but that doesn't mean they'll end at the end of April. They can just kind of extend that indefinitely. But right now the legislature is not in session, so technically there's not any legislation at all in Iowa right now, because legislators don't pre-file in Iowa like they do in some other states. Well, I mean, they're technically allowed to, but they just don't do it. So for all intents and purposes, no legislation at all exists in Iowa at the moment, technically. But we know from having conversations with these lawmakers, from having conversations with leadership, from folks on the inside who let us know kind of what the conversations are. I mean, being a lobbyist is really all about information asymmetry and trying to get as much information as you possibly can from any source that you possibly can. So is it technically introduced right now? No. Is it coming? Absolutely. With absolutely as 0% doubt in my mind, we will have at least 10 pieces of anti-LGBTQ legislation introduced within the first 2 months, 2 or 3 of which will have a serious chance of passing. Second question is, does the anti-LGBTQ legislation play into support for school vouchers being proposed by the administration? Yes, it does. And in fact, school vouchers themselves are, so I wouldn't classify them as a piece of anti-LGBTQ legislation, because LGBTQ people are just kind of hurt incidentally rather than on purpose in that legislation. So it wouldn't make our list necessarily as a piece of explicit anti-LGBTQ legislation. But what I can tell you is that back last year, the interns and I went through basically every non-public school policy in the state. We found like 98% of them. It's like 170 different private schools in the state. And what we found was that 75% of them either explicitly or implicitly tell LGBTQ people that they're not welcome. So they either explicitly say you can't be here if you're a queer kid or if you have queer parents, or they have a clause in there that says we reserve the right to discriminate against LGBTQ kids and their parents should that need arise or should we choose to, right? Only 15% had explicit anti-discrimination protections for LGBTQ children and families written into them. And the voucher legislation, at least the versions we've seen in previous years, has no requirement that private schools follow the anti-discrimination policies that public schools are required to follow. So is it a piece of anti-LGBTQ legislation? Not by like my definition, but does it have significant impacts on LGBTQ folks? Yes, absolutely, because we still have to pay the taxes that are going to support those institutions that we can't send our kids to, right? Like that is discrimination kind of by definition. So yes, the other part of this is that is often used in rhetoric around the voucher policy, basically saying, well, if you don't want your kids to have these teachers who are feeding them the gay agenda, then you should be for vouchers because we can funnel your kid off to a school where we can discriminate against those people and keep them out of your sight. Now, they don't say it in those explicit terms, but that's kind of the implied message that is sometimes delivered by that.
And I think One Iowa Action came out against voucher. I mean, you guys did a lot.
Yes, we're very, very strongly against voucher policy for the reasons that I have illustrated.
Yeah. And did advocacy around it last year as well. So,
yes. And we will continue to push against those voucher policies for that exact reason, right? There has never been any sort of consideration about making private schools follow the same kinds of anti-discrimination policies as public schools would. And, you know, transparency standards and on and on and on. It's not a fair fight at all. So some people will say, well, this is, you know, the free market, it's competition, blah, blah, blah. Well, it's not a competition if one group has a different set of rules that are much, much less restrictive than the other group, right? That's not a competition at all. That's not what competition means.
Yeah, and then besides all the other special ed services, you know, there's a long list of other things.
Yes, disabilities, different religious views. I mean, the list is very long.
Well, thank you, Deborah. I know we're coming up at the top of the hour. You know how to get a hold of me and Keenan. I shared Keenan's contact information on a link, but you can also find their contact information online as well as my own. Thank you so much. First of all, I want to thank all the folks who joined this. It really, as a queer person in Iowa, makes me feel safer knowing that we have allies like you and the Public Health Association on our side. And also thank you to Keenan. This is not easy work to do for a person day in and day out. Keenan is on the front lines of hearing a lot of traumatic things. And I know you are the object of vitriol oftentimes.
Yes.
So thank you so much. They love to
call me a groomer. That's their favorite thing.
And you take it such in stride and just really appreciate that because I know it's not easy. So yeah, thank you. And Brett, I'll turn it back over to you to close out.
All right. Well, thank you, Bethany. Thanks, Keenan. Thanks everybody here who came, and love it if you signed up for Action Words from One Iowa. That link is somewhere up there in the chat. And then I'd also love it if you filled out the evaluation form for this lunch and learn. I just threw that back in the chat. Thanks everybody for coming and spending your lunchtime with us. There's the Action Alert link again. Thanks for spending your lunchtime with us, everybody. Thanks, Keenan. Thanks, Bethany, for sharing your expertise. And we hope you can make it again next month for January lunch and learn, which will be on the 19th. We'll be joined by Julie Sather and some community partners who are going to talk to us about collaborative pandemic response. We're always looking for future lunch and learn topics. We're scheduled through the spring, but we're scheduling for next fall. If you have any ideas, if you'd like to share your work or the work of others, you can contact me at brett@iowapha.org or sharon@iowapha.org. Recordings of this lunch and learn and all others will be archived on the Iowa Public Health Association YouTube channel. You can also find any other webinars that you might have missed. Thank you again. We hope to see you again next month. Thanks, Bethany. Thanks, Keenan.
Thank you. Bye.